evidence that the AstraZeneca would not be sufficiently effective against the strain, the dominant strain at that part. And so it was for that reason then that the rollout was put on a hold. That was back in February.
Through partnership with the Medical Research Council, the department vaccinated 500,000 healthcare workers during the Sisonke Access program. The healthcare workers were followed by the elderly, whose numbers seemed promising.
We have vaccinated more than 65% of people 60 years and older, who are most vulnerable population. So that again is an achievement, but it does mean that 35% of those people still remain vulnerable.
Towards the end of the year, numbers of vaccination administered began to drop. This despite the Vuma vaccine programs and incentives by government.
Then the rollout started on the 17th of June. There were some delays in getting the J&J vaccine. So we started with Pfizer vaccine, and the numbers were small initially. And that was related to the fact that we still didn't have enough vaccines. We had vaccines, but not in sufficient volumes. And it took some time to ramp up our ability to administer those vaccines. But then from about during July and August, we managed to vaccinate a lot of people through September. But then subsequently in October, November, December, we saw the numbers falling. But the numbers were falling because of people not coming forward to be vaccinated.
The department says accessibility to vaccination sites remains an issue. Offenses Timo, SABC News, Pretoria.